Hi, my name is Stephanie. I am a Lincoln Tech instructor. Today I'm going to be talking to you about wound care. So there's a lot of types of dressings you will find. I'm just going to briefly go over it and then we'll talk about how to do a dressing change on a wound. So we have various types of dressing set up. You'll see this a hydrocolloid dressing. All of these are going to be ordered by the physician. So you're not going to be running around and grabbing random supplies. You just have to go with the order says. So this is a hydrocolloid dressing. It helps keep the wound moist. So you'll see that. You also can refer to this in your book. You'll see a chart in your book if you want to see and read a little bit more about it. We have Adhesive dressings, which is a clear, transparent. So if the physician wants to have like a window view of what's going on underneath, this is what we'll stick on it. Again, it's called a Hydrocolloid. We have smaller versions, which are called View Guard. These are also transparent as well. You split them open, you slide it, and you stick it right over, and it's a clear view. If we're going to be doing packing, we have bottles of packing. The packing is like little strips. This one is a 1/2 inch wide. You can see it looks like this. This one is yellow because it's impregnated with iodine. That's also a cleaning technique that the physician or doctor would want to choose from. There's many, many types, but this is an example. We also have, this is an example of a single-use negative pressure wound kit. This is what you would find in a long-term facility. It gives you the instructions on the side. Again, we can go over this in clinical if we do have one of these. This is more in an acute hospital setting. This is a JP drain. We talked about this in class. So you'll see this has, the top has little tiny holes. That's where the fluid goes in, and this is inside the patient, this whole piece. This would be outside the patient. You'll see the flow of the fluid coming through, and this is it's by compression of pressure. So in order to collect the fluid, this always has to be closed, like a little grenade. And when you plug it in, it's gonna look like this. As it fills with fluid, it will start filling up like this. And then you would take this open, dump it out, measure how much it is, but it always has to be compressed. If there is a lot of fluid in here, which you have to check frequently, maybe every 6 to 8 hours during your shift, if this is full and not collapsed, it's not going to be taking any drainage out of the patient. So this always has to be collapsed. This is a JP drain. We have other examples of dressings. This is Xeroform. This is an occlusive gauze strip. It has petroleum in it. This helps keep the wound a little bit, not so moist, but non-sticking. So if you were to put like a gauze on it and say the drainage dried and you're trying to remove that, you don't want to be pulling at tissue or the patient's wounds. So there's various sizes of these. If you need to remove lots of tape around the wound, this is a Adhesive Remover. So you just kind of go around the tape and it kind of peels it off, so we don't want to pull sensitive skin. We have some of these. These are our little Sterile Cotton tip. This can help with packing when we're doing some packing, and I can show you that. These are sterile, so we have different versions of these. We have small gauze. We have drainage sponges. These are the ones that are split open like a little piece like this. This goes around peg tubes. So when we're cleaning that, we clean around underneath the plastic piece that's close to the skin. We can use some of the Q-tips to clean around it, and we just kind of slide it and we crisscross it like this. And that's how we collect the drainage and protect the skin. Okay.
Measuring, you can measure.
Mm-hmm. So I'm going to show you my little woundy.
Measuring that has the, yeah.
So when we're doing wounds, depends if it's going to be sterile or clean. For instance, we're going to be doing a clean dressing. So we're going to have our gloves on, we're going to go into the patient, we're going to do our hand hygiene, introduce ourselves to the patient, tell them what the procedure is and what's going to go on. If they're having pain, we want to pre-medicate them with some pain medicine to help with some comfort. So with clean, you're just gonna have your clean gloves and you're just gonna pull off the dressing. You could use the non-stick adherent tape remover for this. As soon as we open it up, we're gonna look at the color, the drainage, how much it's saturated. These are all types of things that we're gonna document in the chart. So what we can do is, depending if it's stuck in there, if it's dried in there, we can either do some solution, saline solution, to squirt on it to soften it up, and then we should be able to remove it. At this time, I would probably change my gloves if they're soiled heavily. And then we can look at the inside of the wound. So if we're gonna do measurements of length and width on our little piece right here, our little sterile Q-tip, there's a measurement. So we can do measurements as the length. And that's how we would document in the chart. If we are going to do depth, we usually start with the Q-tip, cotton tip applicator, and we kind of gently put it right in the center. You're gonna bring your fingers to the bottom, and then you're gonna pull out. And that's how long the depth is. Then you're gonna take your measurement and measure against it, and that will be the depth of the wound. We're also gonna note if there's any tunneling underneath, and any other things that we need to document on here. So like I said, it's important: drainage amount, color of drainage, if there's odor, the color, and describing how it's healing. So when we're going to say we're gonna be packing a wound, you can use your clean cotton tip applicator, and depending on what the doctor's order is, maybe it's just gauze, maybe it's wet to dry, maybe it's packing, we're gonna gently take one of these and we're just going to pack it in gently. You want it enough packing in here to fill all the crevices, to get all any drainage. We want to make sure it's nicely packed tight in here. So you can see my hand is holding the canister, the other one is just feeding it in. If the doctor has any other orders about filling, putting in creams, ointments, medications in there, that's when we do so. So here we would cut it to the length. I'm just gonna put this right here for now. You would take your gauze or whatever needs to be covered, ABD pad usually, and then you just simply cover and tape it. You want to make sure that you put your initials and date and time, so you know exactly when it was changed. Depending on frequency, sometimes it's every 12 hours, sometimes it's every 8 hours, sometimes mostly it's daily. So you want to make sure that you're putting your date on it so we know that nursing is doing it appropriately.